Following exercises are to help you recover from hernia surgery. We're going to start with the upper body and then work our way down. Even though the hernia is in this area, you got to use your whole body to make sure the whole body's good. So, starting small and fast, and then bigger and slower. Take some deep breaths as you're doing it. Other direction, small and fast, and then bigger and slower. So you're going to do that 2 times. Small and fast. Some deep breaths. Small and fast. Good. Exercise number 1. Number 2. Big arm circles with the knee lift. So like slow. As long as you're breathing, that's the most important thing. Don't hold your breath, but ideally if you can, inhale on the way up, exhale on the way down. All right, so count every time you lift up your knee, count that as 1. So you want to do 20 of those. Okay, getting to 20. Now, if you're just getting out of surgery, don't hurt yourself. Just lift up as high as you can. Right? When you're just coming out, you might be able just to lift up like this, just a little bit, a few inches off the ground. Eventually, obviously, you want to be able to get your knee up to your hip level. All right, that is the goal. Exercise number 2. So now number 3, just keeping it simple with the knee circles. So keeping your feet just inside the hips, going circles outwards. 1, 2, 3, 4, 5, other direction. 1, 2, 3, 4, 5. All right, maybe even 6. And then once again, same thing. Start small when you're just starting from your recovery. Eventually, you should be able to get that hip up to your knee level. Side bends. Feet are hip width apart, like so. Arm above the head, and we're leaning to the side. Once again, don't hurt yourself. Just go to the range of motion that doesn't hurt. Don't force yourself to go anything past that. All right, keep it simple. Think about pushing your hip out to the side. All right, not just leaning with the upper body, but pushing your hip out to the side. 10 on each way. Okay. How to step it up. This is still number 4, but how to step it up is by putting 1 foot forward. So while the opposite foot forward, arm up. This is just exposing that specifically for the inguinal hernia, exposing it just a little bit more to get a little bit more range of motion. Same thing. Just by putting the foot behind you, you should feel this stretch just a little bit more. All right, switching sides, opposite foot forward. Down like that. Exhaling each time. Every time you're leaning out to the side, you're breathing out. Good. Pretty straight. Now, doing the hip circles specifically, if you have the inguinal hernia, even doing small circle like this, you'll feel that right at the beginning. But obviously, the goal is to eventually be able to make bigger circles, especially when you come to the front part. Depending on what side it's on, when you're pushing to the front, when you're doing the front part of the circle, you're definitely going to feel this around there. Once again, feel the range of motion, not pain. All right, so you're doing 5 in each direction, or you can do 10 in each direction 2 times. Okay, big circles like that. Calf raise and calf stretch. So feet hip width apart, hands on your hips. You don't have to have your hands on your hips, just hands at your sides. So it's pretty straightforward. You're just going up to your toes and coming down. You want to make sure that, use all the muscles in your legs. So contract your thighs, hamstrings, your glutes. Keep that belly button tucked in. Up as high as you can, slowly coming down. All right? Up as high as you can, slowly on the way down. Don't just go up and then come crashing down. Up as high as you can, slowly on the way down. And then to stretch that muscle, so right now we're focusing on stretching the back leg, that back muscle here. See how far you can keep your foot. You can put your foot behind you, but still keeping the heel on the floor and pushing your hip forward. Keeping that leg straight, hold it for about 10-15 seconds. Switch the position. Again, see how far you can get this foot behind you, keeping the heel on the floor and pushing your hip forward. Taking deep breaths the whole time. Good. So one of the most important things after you have hernia surgery is making sure you're up and moving around, even though it might be very painful, especially if it's just a few days after the surgery. But the best thing to do is to get up and moving around. Doing these exercises will definitely help your recovery too. So try these out at least once a day, for the first couple of days after surgery. See how it feels. In the following week you can bump it up to twice a day, or do the exercises for 3 sets every couple of days. All right, have a good day.